The Sustainable Development Goals (SDGs) were born at the United Nations Conference on Sustainable Development in Rio de Janeiro 2012. The objective was to produce a set of universal goals that meet the urgent environmental, political, and economic challenges facing our world. All 17 goals interconnect, meaning success in one affects success for others. In short, this is the greatest chance we have to improve life for future generations.
And our team have chosen the SDG 3, which is good health and well-being. This agenda is to ensure healthy life and promoting well-being for everyone at all ages. And how about the aims?
The associated targets aim to reduce the global maternal and mortality ratio, which is to end preventable death of newborns and children and the epidemics of AIDS, tuberculosis, malaria, and other communicable disease, reduce mortality from non-communicable disease, strengthen the prevention and treatment of substance abuse, and halve the number of deaths and injuries from road traffic accidents, ensure universal access to sexual and reproductive healthcare services, achieve universal health coverage, and reduce the number of deaths and illnesses from hazardous chemicals and pollution.
Malaysia has an efficient and equitable healthcare sector comprising government-funded, universal healthcare and private sector-led healthcare. The Ministry of Health acts as both the primary public care provider as well as the overall regulator of the health sector.
However, as Malaysia transitions toward a high-income economy, the burden of chronic and age-related diseases increases along with demand for quality healthcare, and this has led to an upward trend in healthcare expenditure. Aggravating this further is the more recent COVID-19 pandemic, which posed unprecedented challenges to the healthcare system.
However, in December 2019, China reported the first case of novel coronavirus COVID-19. As 9 of May 2020, 274,898 people have died worldwide. Public figures have called it the worst crisis since World War II. This is a story about a country in Southeast Asia that often doesn't get much attention. In March, Malaysia was failing. Newspapers published articles about how Malaysia was struggling against COVID-19. Malaysia had 3 times more cases than any country in Southeast Asia. The virus was in every state and federal territory. What makes the story even more sad is how the infection spread, not from Malaysians partying or being badly behaved. It spreads from a religious gathering. Malaysians being well-behaved citizens had unknowingly spread COVID-19. Malaysia's government quickly made adjustments. Movement Control Order or MCO, roadblocks, closed events, closed schools, closed non-essential businesses. Malaysia will do MCO 2.0 or the Enhanced Movement Control Order.
Due to COVID-19, there are so many problems that affect us, such as students cannot pay full attention to their online classes. Sometimes parents need our help when we are having our class. And also students receive tons of homework and they cannot finish all of them due to the distractions. Because of that, they become emotional and lack of motivations.
And now, Malaysia was hit by coronavirus outbreak in early March 2020. At first, there was no vaccine to kill this virus. However, scientists have been working hard to produce vaccine. There are 3 types of vaccine that our country provided for us. Those are the famous Pfizer, Sinovac, and AstraZeneca. According to research study, those who complete their vaccine are unlikely to be infected by coronavirus. On the other hand, the benefit of physical activity are solving mental health problems and other diseases. Exercise improve mental health, reducing anxiety, depression, and negative mood.
Our hope is that this pandemic can be reversed in the near future and all parties can cooperate with the government to be free from the COVID-19 era.